Well, it's 5:01 and we are going to go ahead and get started. So everyone, welcome to tonight's online community forum to talk about the coronavirus and how it is impacting people in our community. My name is Pam Duncan. I'm the president and CEO of Metropolitan Development Council, and I'm joined today by my good colleague and sister, Tawina Nobles, president and CEO of the Tacoma Urban League, with whom we are partnering for this series of conversations.
Hi, I'm glad to be here. Thank you, Pam.
Mm-hmm.
Oh, okay, I'm going to keep us going. So I'm excited for tonight's conversation. And this will be the first in this series of discussions where we definitely will dive into how the virus is impacting the Tacoma Pierce County area. I'm excited for the call tonight, although it will be more general in nature and focused on what makes the virus so different. We also will have an opportunity to learn why the response to this worldwide pandemic has emphasized limiting exposure to the virus and how the virus is impacting our individual lives. And we have a great mutual friend on with us tonight. But Pam, I will hand it over to you. We're definitely grateful for this opportunity to partner with Metropolitan Development Council tonight.
Thank you. I really feel the same way, that we have this opportunity to partner, and we will be here for the community throughout the COVID-19 or coronavirus crisis. And here's what the lineup will look like over the next several weeks. As Tawina mentioned, tonight is more general in nature, and you will be hearing from our guest this evening, who's really going to give us some good lowdown on coronavirus. But next week's meeting will really highlight the impact that coronavirus has on, the disparate impact that the coronavirus has on people in the Black and Brown communities. We want to really help elevate and highlight what's going on in those communities. And then following that, we will be talking about how coronavirus really impacts our education system, and especially the students who are in high school and in colleges. And then we will be talking about the impacts of the coronavirus on the community of those who are experiencing homelessness. So we just want to really take advantage of the reach that we have with our communities to allow folks to have a platform where we can talk about these items. So Twina's gonna just now talk about what's the overarching thing that we want to drive home during this time.
Thank you. And the most important message throughout this series of conversations is that there is hope for our community. All is not bad. We are dealing with a challenging situation. There are lives that are at stake, and we want to get a hold of this virus. We want to flatten the curve, and we want to see our community back whole. But there is hope. We are in this together. And our focus in this series is to create a space during each meeting to talk about resources and things that we can all be doing to help get through this pandemic. Because many of us, and we're hoping that all of us, will believe and know that we will survive this, and we will definitely be better together.
Thank you, Twina. Throughout today's conversation, you can submit questions to be addressed by our speakers using the chat function in Zoom. And so if you are not familiar with that chat function, if you just take your cursor and hover across the bottom, there will be a little item, looks like a little balloon, cartoon balloon with chat. And if you click on that, you will be able to send your questions to our moderator, and then it will be shared with our speakers. We will do our best to consider every question, but we also want to make certain that we get through the allotted time that we have and talk about the items on our list. And then as a general housekeeping matter, and for the security of everyone on this call, everyone's mic has been muted during this call with the exception of the speakers. And we're not allowing everyone to show their faces on the video, and this is for security reasons. We've also disabled the global chat function, but you can submit your questions again to our moderator through the chat function.
So I'm excited to introduce our guests tonight. On the line, we have Dr. David Hirschberg. He is from the RAIN Incubator in downtown Tacoma. He's also in my class of American Leadership Forum. He's my classmate. Dr. Hirschberg and the RAIN Incubator were featured in the News Tribune recently, describing how his team is working to take some of the burden off healthcare systems through opening up new ways to do testing for COVID-19 and for studying, among other things, what the antibodies from those who have recovered from COVID-19 could mean for the virus going forward. Thank you for joining us, Dr. Hirschberg. Will you take a moment to introduce yourself?
Sure, thanks, Tawana, and thanks, Pam. Great to be here. For most of my life, I've been a basic researcher. So I was back in the lab doing work. My expertise is in infectious disease and immunology, but we often were hunting viruses. So I've worked in various entities, either at universities or in private companies, returning back to Tacoma about 5 years ago to really start up a biotech incubator to train students in how to do these things, how to do threat detection. It was relatively easy for us to kind of pivot from our basic research of training students in our community to this disease. And again, working through a lot of different backgrounds, I have deep ties in the biotech community. It was relatively easy to pull in a number of researchers and to pivot a lot of our projects that were helping small companies start up to focus on developing some tools to better identify and characterize the virus in our own environment, our own community. And then hopefully, as more and more resources become available, like governments, we can start working with some of the larger companies to really talk about drug screening and then vaccines.
Thank you.
Thank you. So, Dr. Hirschberg, tying back to how we typically respond to a flu, why are we being asked to take such drastic measures about social distancing in response to this pandemic?
Well, that's a good question. Actually, I think for many diseases that we take for granted, such as the flu, which to some people are very, very serious diseases, we actually lose about 50,000 people a year in the United States to the flu, mostly young, are very young and very old, and people who are sensitive, or who basically are immunocompromised. So honestly, a lot of the things that we're doing right now really should be done for for those viruses that are commonly around us and we have come to take for granted. The reason this one is different is because it is completely new. It is something that humans have never been exposed to before. And many of us don't have any immunity to it. So many more of us will get sick. Many more of us will die than in a normal flu season. And so as a result, this is the biggest issue has been our hospitals, which are designed for a certain level of sickness, have never been designed for something like a pandemic. And so what Tawana was mentioning of flattening the curve is really important. We need to socially distance right now because some of our other systems have failed, and we need to slow down the amount of people who get sick, and then flatten the curve so that our hospitals can keep up with us, not only for treating this disease, but any other of the routine or things we anticipate coming in, into the hospitals. We need to protect those resources so that they're preserved to kind of handle this influx.
So I know you're Dr. Hirschberg. Is it okay for me to call you David? You're David to me.
Absolutely. Please call me David.
Okay. David, do you mind telling us a little bit more? You can explain more about what you've seen in the community, how the virus is impacting the community, but if you also will let us know how the virus is impacting you.
Yeah, so most of my life, I've gone other places to look for viruses. We've had outbreaks either in the cattle industry, horse racing industry. We've gone, I've worked in Peru and Thailand. And so it was always, we were trained to go places. And so this is really unusual for us in that the virus has come to us. And so this has been unusual because, usually we kind of have a fairly good idea where it is. We have all the tools and tests. And of course, in this situation, it's everywhere. It's all around us. I think, from my standpoint, there's more of a risk contacting people in our grocery store or, in a social environment than in my laboratory where we kind of know where things are. So this has been very disruptive for us. It's been strangely normal for us because in my lab, we have many people here working. And so we are working very hard on it. We spend long hours. And so that part of my life has been very normal in the lab, unlike everybody else's life where people are mostly at home.
Thank you. Pam, I have another question unless you wanted to jump in.
Go.
Thank you. So, David, I've heard quite a bit of conflicting information about how easily the virus can spread. Will you let me know true or false, or you can dive in if it's not that easy? Am I likely to catch it? And am I likely to catch it just by passing someone who has the virus and might be, visibly displaying symptoms or not? Is it that easy?
So you're unlikely to catch it that way. The person would have to sneeze on you and breathe on you in order for it to pass. Or the most common is they sneeze onto their hand, or they've not washed their hand, and then would touch you in some way, like shake hands with you. And then you would go on about your day, and instead of washing your hands 50 times, which you should be doing now, you may touch your face. And so that's likely the scenario where it would be passed.
Okay,
it's interesting, David.
Go ahead,
That
Pam.
was just interesting. As David was speaking, I realized both of us had our hands on it at our faces.
I was like,
yeah.
Go ahead, Tawana.
What about drive-throughs, takeout? So restaurants are still able to serve food. We're not in the kitchen. We're in, most of us, you can go inside a coffee shop to pick up coffee. But what can you tell us about catching the virus if we're having food delivered to our homes? I know pizza establishments are saying, from oven to box, we're not touching it. I personally believe that's what was happening before, but now it just makes sense for them to market that. But what should we be thinking about if we're picking up coffee from a coffee stand and someone is handing us our cup? What should we be thinking about if food is being delivered to our home? Should we be concerned? Should we continue to do those things?
Yeah. Well, while this is a new virus, it is, you know, and it has its own characteristics. You know, it's very related to other viruses that we've seen that are similar to this. So you've heard of SARS, which is SARS-CoV-1, and then MERS, which is the Middle Eastern Respiratory Virus. And so these viruses are very similar to SARS. And what we know from them is that they can persist, but generally they persist in droplets. It's unlikely, although there's very different, you know, there's a fine line between what is a droplet and an aerosol. But at some point, it's mostly droplets. And so the idea of this particular virus persisting long periods of time on a pizza box or on a shopping bag you know, there's not a lot of evidence that shows that. And we do have results that the virus can be detected, but it hasn't been proved that it's infectious. What we do know is that contact, hand-to-mouth contact, we know that there's evidence that this is also present in the feces. So there's, you know, just the same things, the precautions you would take for norovirus, or, you know, if somebody's sick on a cruise ship, you've seen this, and close contact, families living in close contact. These are the ways these are spreading. There's less evidence that it's spreading on surfaces, Amazon boxes, you know, or on pizza boxes. So I think while the individual who serves us meals at McDonald's every day in the drive-through, I think is really on our front line and taking you know, a relatively high risk to those of us that are receiving food at home through Uber Eats or you know, or doing Zoom calls, for instance. You know, I think that is much more of a risk because that person has a chance of coming into contact with more and more people. But for us in handling items, especially if we're washing our hands often, relatively low risk. And you can see the numbers really, as we've socially distanced, really reflecting that.
Thank you.
Thank you, David. I noticed that several more folks have joined the call, so I just want to remind you that your mics have been disabled. However, if you have questions, you can submit those via the chat function at the bottom of the Zoom screen. And so we have a couple of questions that have come in. David, do you have any advice for parents who are trying to convince their kids to be more careful about social or physical distancing?
Yeah, I mean, it's really tough. I can't imagine being, you know, a kid in this environment. It's tough because that's pretty much our whole lives, the social lives. But it is so important. I mean, the disease looks from the stats, it's still risky. Young people are getting sick, and young people in some cases are dying. But the majority of the risk is to our older population. And, you know, young people are really playing a huge role in this. They may be symptom-free. It's very hard to tell when you are infected. And so if you are, you know, somebody who's come in contact with more people outside of our defined groups right now, it's potentially, you could be somebody that's carrying it to other places in the community. So really, it's really critical that we all really abide by these and really to protect those most vulnerable in our population.
So I have a question. I realize we've talked about what is going on, the impact throughout the community, and that we now have a pandemic. This is worldwide. But what we haven't really talked about is what happens when a person gets ill, gets infected with coronavirus. And we've heard a lot about now they're symptomatic. So what is going on with their body that makes this such a potentially deadly infection?
Yeah. Well, so there's several scenarios that play out, but mainly this virus is really a strand of RNA. Technically it's a chemical that's been wrapped in a protein package. And these viruses can't even reproduce unless they are growing inside a human cell. And so when they come in contact with like a mucous membrane, such as a respiratory membrane, they enter the cells and start reproducing very quickly. Positive strand RNAs are very infectious and they multiply very quickly. And so many times in the case of this virus, people will start shedding the virus even before they are really showing any kind of symptoms. And many people could be completely symptom free, but still transmitting the virus. And so in this case, that's really the biggest issue right now, is we don't have a good correlation. We can test for it if there's enough tests, and we can isolate people, but that's been our biggest issue right now. And this is a highly infective virus, not as infective as other viruses like measles, but certainly more infective than SARS and older other ones we saw, MERS. And so it spreads very rapidly. And if we have no way to detect it, which we don't have enough kits right now, then it'll spread rapidly through the population.
Well, will sunlight or UV have any impact on the virus?
Yes, these viruses are very sensitive to environment. They do not persist very long outside the body. So UV light will destroy this virus extremely quickly. And yes, even in sunlight, there's enough UV light. Any drying out on surfaces, of course, any kind of cleanser that people are using that wash the surfaces, Purell, which disrupts the virus very quickly. They really don't last long in the environment outside of a human cell.
And what about masks? So are masks effective for non-medical workers? And when people wear a mask, who is it protecting, the individual or those around them? So if I am positive and I'm wearing a mask, is it really protecting folks beyond me?
Yeah, so there's a lot of debate about this. I mean, so first of all, I'd like to say the CDC officially is recommending these non-medical masks, but they also are recommending, this is a series of different protections that you would use to combat this virus. So clearly, if you are exhibiting symptoms, the best thing you do is stay home and have somebody else go out and grocery shop for you, because it's very important. So the mask is really in the times of a non-pandemic, it's one of the tools we use. So you might have seen them in the subways, in the Japanese subways, if somebody's sick. But for this type of illness, it's better you're at home. But that said, yes, it probably would cut down on the amount of material that, if worn correctly, and you didn't touch your face and you didn't breathe out the sides of it, it probably would cut down. But again, should be at home. And the other thing is N95 masks, which you hear about now, we all know about. The medical grade masks are very effective if they're worn properly and not for long periods of time. But right now we're reserving them for our medical personnel and people and first responders. And so what I ask my people here at RAIN is to send those to the hospitals and let the first responders have access to them. And then there's other things we can do to kind of in that secondary and tertiary, washing our hands, staying 2 meters apart. They're very effective, but they have to violate those rules in order to treat us.
Thank you.
I have a couple of questions. So many of us hear these terms that are thrown around all the time, and you actually mentioned one of them, flattening the curve. What does that mean? What does that mean to the everyday person?
Yeah, I'm hoping some of these get more common, but also if I say anything that's jargony, please shut me down right away and ask me questions, because we'll get into our good. Yeah, so flattening the curve is really, a pandemic. We already know the calculations. There is something called R naught, which is just a term that's used in kind of calculate how fast this virus would spread through a population, given certain factors, many factors, how close people come in contact, how dense the cities are, what's the chance given through the day that if you come in contact with 10 people, how many are you going to spread it onto? And so those are these are almost like a video game, how you can calculate how fast they're going to spread. And so what happens is you have this exponential infectivity stage where you have a chance of meeting people who have never been infected before, and many of those would become infected. And so that curve looks like a camel's hump in a sense, and how steep that is really a determination of how fast this will go. And by flattening the curve, what we're doing is we're still saying that everybody's, the same amount of people might get infected over time. So the area underneath that curve stays the same, but it's going to be lower and longer. It'll be much more flat, like instead of a steep hill, it'll be an easier hill to climb. And that represents it's basically spreading it out over time, allows our healthcare systems and all our manufacturers of gloves and masks. It allows the vaccine makers to move, to basically have more time to make these vaccines, more treatments, and basically by flattening the curve, you're spreading this out so that we don't have a complete collapse of our systems, which have never been designed to face this kind of frankly onslaught of cases.
Mm-hmm. So another term we've heard, we've all heard this, is that we are having a pandemic. And what's the difference between a pandemic and an epidemic?
Yeah, there's getting in the weeds with the names. So generally, when you have an outbreak of a disease, it's relatively localized, and of course the standard response is to really localize it in an area. So if you see a local outbreak, it usually can be contained. An epidemic usually is something, again, emerging disease that comes, that occurs in an area it's not normally in there. And it can be very serious, but it's usually localized to a certain area. A pandemic is usually declared when something goes kind of global. It overwhelms the system in the local area, as it did in Wuhan province, and then spreads globally. And of course, this basically makes most of our playbook that we, as we combat these kind of illnesses, it really changes the game of how we can do it, because you can't localize and isolate to just certain areas. You have to really now go to a kind of global playbook. And you can see that it actually overwhelmed our resources in terms of how prepared we were to battle something like this.
So we are getting more questions in. I do want to go back and ask a question in a different way. We've talked a little about, or actually quite a bit, about the social distancing aspect and why that is so important. And even when people, there are folks who may be infected with the virus, but they don't show it, and they may not even physically be aware that something is going on. But because it is it's such an infectious, contagious disease, and it can impact folks, and we've been hearing about all of the folks who have been passing away, I think it's just important to elevate, like, what happens so that a person ends up going to the hospital. What's going on with their body that they end up having to go to the hospital and creating such a demand on the healthcare systems?
Yeah, for a subset of us, we're going to show, so with most infections, the people who end up in the emergency room really are a small part of the population. So even with other diseases, really, it may be less than 1% that end up in this situation, the ICU. Most of us will have minor symptoms. Many of us will not even know we have COVID-19 disease. But for a number of us, especially those that are at risk, and by that they may have other underlying medical issues. So if you have COPD, if you have lung disease, if you have cancer, any kind of underlying diabetes is an indicator. If you have these these other issues that already have compromised a lot of resiliency, these kind of conditions can add to it. In addition, there's many of us that are we look normal, we're healthy, but we have some underlying susceptibility to this particular virus. Either our resistance is lowered, or we just have no immunity to it. And so for those people, generally they'll have a worsening of symptoms. And again, many will end up in the hospital, but some will need to be put on these machines that breathe for us, essentially. And again, it is not, when you're in the hospital, there's no treatment for this disease. What the medical strategy is to keep you alive long enough till your own body builds enough immunity through antibody response and really fights off this virus. And so it's really buying you time by putting you on these ventilators or putting you in the hospital with some kind of support. It's exactly like buying you enough time so that you can beat this disease.
Mm-hmm. So let's think about the future a little bit. David, if you can help us. How might our community look once we start returning to our lives? And do you have an opinion on when we should start looking at opening up our day-to-day activities and lives and move away from social distancing?
Yeah. So I have strong opinions. My expertise is really in infectious disease and science, but we can talk about why this is and what's going wrong. I can tell you, though, it's very hard for me not to express my opinions and my bias. And I want to stress that we will get through this. This is a serious challenge to us, but by social distancing, you can already see in this state alone how much of an effect it's had in slowing down the virus, where we're actually sending back ventilators to the East Coast where they know they need them, where the densities are higher. And so I do think we will get through this. And I do think that, as Dr. Tony Fauci says, who, really, if you have any questions after I've said anything, you should go look him up. He's the head of infectious disease at the NIH, and really has been kind of the spokesperson, the go-to person really for the science and best advice. But he is, basically the virus is dictating this right now, and it depends where you are. If you're in New York, it's going to go differently than hopefully in Washington in terms of when we can go back to work. But clearly the amount of virus, the amount of new infections is a great indicator of how we're doing. And you can see already that the number of severe cases is really leveling now, which is great. So we have to stay on top of this, and we have to buy ourselves some time. That said, I have some very strong, I'm quite upset how this virus has really disproportionately affected our different communities. And it clearly, unfortunately, goes right down racial lines and economic lines. And this really, the virus is really exposing some existing weaknesses in our culture and society. I'm hoping this is a great opportunity to really heal this, because these problems were here before the virus. And now we have a great time. This is a great time to actually try to figure out how to do this better and really improve our level of health in the community.
So staying in the lane of thinking ahead, if you'll talk to us a little bit more about an antibody and vaccines and what the future will look like for folks who have not been sick yet, or folks who are in high-risk groups. So even after we've gotten things under control, what are we to expect without a vaccine, without something that
Yeah.
will keep folks from getting sick?
Right. So, for combating pandemics, we have, a standard pandemic playbook, and this really hasn't changed much since the, H1N1 1918 flu. So the social distancing is really important in really bringing these things under control. And then again, but we also have newer tools. So we do have diagnostic tests that are being ramped up and deployed. And so that's going to be really important to really understand where the virus is, both in the environment and also in individual people. The second will be antibody tests, which can give you an idea if you've seen this virus before. And while it's not 100% correlative, it does show that once people have been exposed to that and has some antibodies, they have a little bit of more immunity. At the same point, we can also find out who in the community has never seen it, and we can take steps to isolate them. So if people are at risk, if people are sick from other illnesses, this is a community we can identify, and we can take steps to isolate, or at least put resources in there close to them in our hospitals that can take care of them. And I think as we go through this may take a few months to get all these tools in place, but this is our first step. There are drugs that are being screened against this now. We do look at people who survived and try to ask questions. Why are they different? What do they have that other people don't? And so there'll be a number of drugs that can be deployed and screened. And then finally, vaccines, which usually take 18 months to 2 years to really develop, will come into place. And if there is a will in our culture to invest in these kind of tools, those will be put in place.
Thank you.
David, when will we know, what's the marker that we'll be using to know that we're on the other side of this?
So the markers are there. If you go to Johns Hopkins, and I can supply these links, I've given them to Juana before, so she's up on it. There's actually the stats really looking at on where the new cases are. And so remember, everything we're seeing today is really reflecting what decisions we made 2 weeks ago, because the incubation period is about 14 days. And so we're seeing already cases dropping off. Even in New York, as horrific as the news is coming from New York City, we're seeing already a leveling of deaths and new cases. And so that's really a good indicator that what we're doing is working. And if anything, it makes it harder, saying, oh, well, cases are dropping, we should stop doing what we're doing. But really, remember, we're working on a 2-week shift. And so in 2 weeks, it'll be better than it is now. And we are going to slowly get through this, but you can easily have a backlash. And so I think what we're doing right now is when you see we're flattening the curve, already in Washington State, people think the worst was around April 2nd. And so we're on the other side of that curve, but we still got to go down the backside of that camel's hump. And it's going to take some time, but the payoff is incredible, because this will get us through this and really get the faster we will get our lives back to normal.
So by taking our time, would you say another month of quarantine is necessary?
Again, I wish I could say that. I would say, exactly what Tony Fauci said is the virus determines that. It really, and us, how, as tempting as it is to go out in the parks right now and mingle with a bunch of people and to throw a backyard party in secret, how much can we resist that temptation and really just keep doing what we're doing and watch those numbers go down every day. And I can't say a month. If you look at the curve, you can kind of make your own calculations. It may be that some of us can start going back to work and being in a normal life. Of course, if any of those tests become available widespread, and we can really test mainly our first responders, we can maybe stop doing these staggered shifts. And maybe at some point, kids can go back to school. If we could establish that they have some kind of immunity, or that, they've been seeing the virus for a while. But those are things that will drop in that will only improve things. But, it looks like it's going to be June 1st before we really see our lives go back to normal. And even then, it's going to take a lot of time to really get, the jobs back and people back working again.
Mm-hmm. So, David, what are the biggest things that people continue to struggle to understand about this virus?
Boy, I field a lot of things. So a lot of this is the pseudoscience that's going around it. There are, just like there was in 1918, a lot of people are peddling a lot of cures. There's a lot of theories going around of what the cause is, whether it was engineered in a Chinese lab, or, there's just a lot of these, there's a lot of speculation. I always kind of look at the, Occam's razor. The most likely explanation is likely what it is. And I can tell you that it's very hard to build these things, but it's very easy to create them and select them if our systems are sloppy like they were. But regardless, what the virus has shown us is that we have weaknesses, and we need to strengthen those areas. It's you almost look at this as a war, and a military that loses a battle because they left their flanks open. That's their fault, right? We don't blame that on the enemy. And I think that we need to really start looking at really in our own society how we strengthen things. And so that's really been my biggest issue. Again, going to the websites, it's trust and verify, but the CDC has excellent information. WHO has amazing information. If you start with those websites and get the information, NIH, Tony Fauci, listen to what they have really, and then from there you can stray into other websites. But if things start deviating too far from that, if people are talking about 5G causing this virus, you really have to, pull yourself back to some of those sites and really start questioning, what is the underlying ideas that are beyond this, and how would they affect you? Do they make you any safer if you subscribe to those? And those are, that's the best place we can start, is really start looking at evidence-based, science-based approaches. Ask questions, question, everybody, but really look at the sources of credible sources, and kind of train your mind to really look at, make rational decisions right now, because this literally can save your life.
What about opportunities? And I know this is a strange, even odd time to think about opportunities, but do you see ways that the community can adjust as we think about our future? Do you see ways that we can create new opportunities on the other side of the coronavirus? And a second part, in addition to what opportunities do you see, what needs to be done to set our community up for success?
Yeah, that's actually a great question, because really I'm really try to be positive. You want to have hope, right? And so this is an opportunity. I mean, this is a time where we should really be looking at what worked and what didn't in the past. And so if you're questioning, whether universal health care is a good thing, there should be less doubt in your mind right now. This is something we should really push harder. I think Cuomo mentioned that right now in New York, there's no difference between a private hospital and a public hospital. And so we just need to break those things down. Education, I think, is more important than ever. And it's not just for certain areas of our society. Things that that weren't important before this suddenly are very important. And I think that really this is a great time for young people to really take more control of their lives. And through that is education, that is science, mathematics. these key jobs, jobs that were very considered very coveted before this, you may realize that they may go away. You can do a lot with a Zoom meeting now. We may not have to fly around and do that. But what about people who are serving food? The workers at, making minimum wage that 2 months ago, everybody was complaining about, why are we paying them that much? Those Uber delivery drivers, those are really people on the front line right now. And I think we should have this real conversation in our country is what is important. And clearly those jobs are important. And so I think that, and those people are important, and they've been risking their lives to feed a lot of people that have been sitting at home watching Zoom meetings. So I think that, this is a chance. I'm not teasing you, Joanna. I mean, we all had to do this, but I mean, I think that, this is really our chance to rethink our society. How do we get around? Why are meetings important? Why do I have to fly somewhere to go there when I can do this? And, how important is it to get a meal delivered to you and have this done? And what, so I think this is really, when you think of, BC and AC, AD, this is really before Corona. This is really, I think this will be defining our culture and how we want to rebuild it and what is important to us.
Thank you. Pam, I'm sure you have some questions, and I know in the chat box, we're asking folks to drop any additional questions as well.
Mm-hmm. Yeah, David, this is something that's almost like a big duh. Maybe we haven't thought about this so much, but typically it seems that people are more likely to get ill when the weather changes, right? In the fall and the winter on into early spring. We don't see people with the flu as much during the summer. And so why is that? And then what might we expect or need to prepare for when that season comes back around as it pertains to coronavirus?
Yeah, so that's a great observation, and we've tried to, obviously for flu, you have something called a seasonal flu. There's many factors for that, but right now there's no evidence that coronavirus, this particular coronavirus, will become seasonal. We're kind of hoping it will be. It would abate a little bit in the summer and give us some time. But we don't know really what's going to happen with it. That said, respiratory viruses tend to happen at certain times of the year. It's usually when it's colder, moister, damper. But that may also be because we're inside more and we tend to congregate more together. We don't go, whereas during nice weather, we go out and we, in a sense, social distance because we're out playing Frisbee or something like that, or going for a walk in a park. So it's yet to be seen how this virus will play out, and whether it will go into some kind of seasonal pattern, or whether it will remain with us until we figure out a way to tamp down its numbers, probably through social isolation.
Mm-hmm. Thank you for that. I just want to remind folks that you have an opportunity to send in your questions. We have a little bit more time before we end this conversation, and we certainly want to hear from you, and so that we can discuss those questions that you might have.
Yep. And Pam, if any questions come in afterwards, I'm happy to take a stab at answering them. If I don't know the answer, I'm happy to refer it to a bunch of people I hang out with that are smarter than I am.
Wow. I just think that this conversation that we've been having is very important for the community at large to have access to, because so many folks get their information from sources that may not necessarily be credible, or people have just tuned out from mainstream media and aren't really getting a really clear understanding of what is happening in our community at this time. And I guess my question would be, what does the new normal look like? What's your thoughts about what the new normal will entail?
Yeah. Well, I mean, obviously we're going to get through this, and I think we're doing a pretty good job so far. We need to do, it'll be a little while before we get it back to normal, but I would hope that we incorporate a lot of the, you know, the habits that we're talking about now. So, you know, why do we not think about the disparities in our community in healthcare more? I mean, why does it take a coronavirus to really show this? Because we have these issues every day. We've become used to them. The flu, for instance, 50,000 people a year die, at least that we know of. And that disproportionately hits communities. And so these numbers are racking up every year. You can go to the CDC and look at the numbers. And so I think we really have to, you know, take this seriously. It's really, our focus shouldn't be on how sick our community is or how sick different communities are. It's really, what does the health look like of our community? The whole focus of our program should be, how healthy can we keep people? And we really have to look at some of the public health successes. We have vaccines that aren't just for certain people, it's all of society. If you only vaccinate a certain population, it puts us all at risk. It's just like toilets. You can't give toilets only to the wealthy. Everybody should have a toilet. It's just, you know, it's the, you know, we really are healthier if the weakest in our society are healthy. And so I think that from a public health standpoint, we need to rethink this, and we need to have these conversations. And there's a lot of us who work on the front line or in research that do this, but it really has to be from a group, public kind of approach, and it has to be from a society. And it's not just certain people can participate and others can't.
Mm-hmm. David, speaking of certain people, I know the urban leagues and other groups led by people of color, we've been trying to chase data on different ethnic and cultural groups. So are you all talking about how communities of color are being disproportionately impacted? And then I also want to throw in another question, if you can talk to us about antibody testing locally.
Yeah. Okay. So yeah, and I have not tried to skirt around this issue. If it's not clear, I mean, the Black population is disproportionately affected by this, as they are any other health consequence. And so, you know, so this is clearly, you know, the virus is just opening up and laying bare what has already been going on for a long time. And so these are conversations. And, you know, there was early on even discussion. I heard Black leaders and communities say, well, this is, you know, it's really not a problem for the Black community. This is somebody else's problem. Look at Europe. Everybody's, you know, it's not, you know, it's not a racial thing. It is here. And clearly that discussion's gone away. We need to really look at this now. And it is appalling in the cities, the disproportionate number of Black body counts that there are compared to other groups. And it's just laying it bare. So I think this is a discussion, and this is important for epidemiology to make sure these deaths are recorded and they're recorded correctly, because we are going forward. We have to go back and really expose and hopefully learn these lessons so that we can use this as a very, very clear demonstration of what is really, we see as we've kind of gotten glossed over as an underlying cause in a lot of other issues.
Thank you.
So for antibody testing, yes, that is something that's going to be important in this area. Again, it's right now much more relegated to research, because we don't know that just because you have antibodies that you're protected. What we can say on a population level, and we need to measure all populations, is not just people who are sick and recovered. We need to look at the circulating antibody in the population. And that is it is a correlation between how many people have seen the virus. And, you know, we are trying to protect people. Eventually, almost everybody will see the virus. Many of us will get sick, but not all of us will be severely sick. We just want to slow that down. And then there's other ways we can measure. We can measure from the environment. Where is the virus? So we know the virus came from bats. We should be looking in bats this summer to see if it's gone back into bats, and we can measure that in our environment. You're seeing reports of being able to detect virus in sewage. So that is one way you can measure if a community has it. It's likely not infective. You will see many reports showing that we can detect it. That's actually a good thing, because it's a way for us to tell where it is, and that's the first step. Is if we know it's in our environment, we continue to be vigilant and protecting ourselves.
Tawana, thank you for bringing up that question about the disproportionality. We do plan to focus specifically on the disparate impacts of coronavirus on Black and Brown communities next Monday. And David, thank you so much for making yourself available for this conversation today. One last chance for folks to send in their questions. If you have those, please send those via the chat box. And I'll just give us one last moment before we close out this conversation, if anyone has any questions or comments.
While we wait for those, David, has there been any recycling of the virus that you have been aware of?
What do you mean by recycling, Tawana? Do you
Can
mean
you catch
like
it twice?
Yeah. So I know there's been reports of that, and I've often proven wrong. But at least as much as we know about viruses, you know, likely I would say that those are errors in testing, or that people were released. Many times you could be respiratorily negative, but the virus is in another part of your body. We generally don't catch the same virus twice, or the same bacteria twice, once you've beaten the disease. Now it will change. It'll mutate over the summer, over time, and then it's likely it'll become the new virus, or the new type would be infective. But right now, it's hard for me to understand how we have many hundreds of thousands of people around the world that have recovered from being sick with this virus, and they are healthy, and they're able to work and go back to work.
Thank you.
Oh, David, you brought up an issue, and you and I have talked about this a couple of times, and it sounds like what you were referencing is that there is the possibility that someone can test negative and actually have the disease.
Yes, every test can be either have a defect in it, the test doesn't work, or they make the measurement at the wrong place. All you're asking is the virus in the test sample, and if it isn't, you know, it may be another compartment of your body. So that's, you know, it is possible you can miss it. Generally, I think people have a good understanding of the test, and obviously over time, if after several days after exposure, if you're negative, you're probably going to be negative. But generally a test can be missed. There's only a narrow window when people are maybe infected by the respiratory tract, but they can be infected for longer periods. And if you're shedding virus, say in your feces.
Okay, one more question.
Sure.
That just came through. To what extent should we be concerned with rebounding effects after flattening the curve?
Yeah, I think that's a big concern, right? None of us wants to go back to where we were, and you really almost can start going back. So, you know, for us, that's, you know, looking at what's happening in Wuhan, it looks like they've done a really good job of controlling it. We'll also see in Germany as you know, those, and now pretty soon in Italy, as they start allowing some people to go back to work, we can watch this. And so this is lessons learned for us to see, we can learn from those communities and see that. But I think we're going to be very careful. This also, as more tests come available, less people get infected, then we'll have enough tests to really test people and routinely test. But a rebound is something we should be very concerned about.
Pam, if you can hear me, we could not hear this most recent remark or comment that you're making.
Thank you. I didn't realize I had it on mute. Thanks so much, Tawina. Throughout this conversation, we've been talking about that there is hope, or just really giving the facts as it pertains to what percentage of folks get severely impacted by coronavirus. But we really want to close with resources and things that you can do. And so you've heard this 1,000 times probably, and it doesn't hurt to hear this one more time. Make certain you wash your hands.
Yep.
We've probably all paid more attention to washing our hands than we have throughout our entire lives, but you cannot overdo it. There's actually a science to how the disease is killed when you are washing your hands and using that soap. And it's also really good to practice self-care. We're all in situations right now where we are communicating with one another virtually, and it can be, sometimes that can be pretty frustrating that we don't have that regular interaction, that face-to-face interaction with folks. Take good care of yourselves. And I've heard anecdotally that folks are doing things like reaching out to their elderly neighbors, those folks who are most at risk, who have underlying conditions that would put them in a serious situation if they were to contract coronavirus. So look out for your neighbors and your family. And I've just heard about folks running errands for their elderly neighbors. And those kind of things are really good for us to be doing, to take care of one another and to remember that we are bigger. This issue is bigger than any one of us, and that together we can all make it through this.
Exactly.
Why not? So you have some things up.
Yeah, thank you all for your time. Thank you, David, Dr. Hirschberg. Thank you, Pam, and all of the community members on the line. So if you all have an opportunity, you can go to thetacomaurbanleague.org for a variety of resources for youth. We're providing transportation. We're providing small business owners and entrepreneurs support with SBA products and applications. And then there's a list of things that we are doing to serve the community. We've taken some of our programming online to Zoom. And if you have not already, please be sure to register for our free but second annual State of Black Tacoma virtual town hall.
Thank you for that. It has been a pleasure to partner with the Tacoma Urban League and kickstart this series of community conversations about COVID. We want to just give straight talk about what's going on in our community, and also to remember that Metropolitan Development Council, your community action agency, is also here, has continued to provide 24/7 services to the most vulnerable in our communities. Our detox unit, our evaluation and treatment centers remain open. We are still providing overnight sheltering. Actually now it's 24/7 sheltering at Bethlehem Baptist Church, and also continuing to provide supportive housing to those who are most in need at Randall Townsend and the Avenue. So we just appreciate everyone making the time to participate, sit in, listen, learn. Don't forget to join us next week, next Monday, 5 o'clock, right here on your favorite Zoom channel. We did record this, and you will be able to watch this again in perpetuity. So again, everyone, thank you so much. Dr. Hirschberg, thank you so much. We appreciate everyone, and have a good evening. Bye.
Thank you. Thanks, Pam. Thanks, Twana, for all you do in the community. Thank you.
Thank you.
Thank you.